Hello everyone. In this video, we'll be reviewing steroids. Some general information. Steroids have a stronger anti-inflammatory ability than NSAIDs. Adrenal insufficiency, endogenous steroids that the adrenal gland is not producing. Cortisol may be replaced by any steroid. Steroids must be tapered off. For Addison's disease, adrenal gland not making enough cortisol is the opposite of Cushing's disease or syndrome. You want to treat with fludrocortisone. Replacement therapy is to mimic the aldosterone. This means increasing the mineral corticosteroid activity to balance H2O and electrolytes. When patients are taking steroids, you want to reduce systemic risks by every other day dosing, tapering off, use injections, inhaled steroids for asthma, use of low absorption, and the lowest effective dose needed. For medral dose packing, you want to direct patients when taking the medral dose packs, and you'll counsel them by saying on day one, you'll take 2 tablets before breakfast, 1 after lunch, and 1 after dinner, and 2 at bedtime. For day two, you want to counsel them saying 1 before breakfast, 1 after lunch, 1 after dinner, and 2 at bedtime, and so forth until day six, which is just 1 before breakfast. For oral steroid dosing equivalents, you want to memorize cute hot pharmacists and physicians marry together and deliver babies. That way you'll see you have cortisone at the top, 25 milligrams, which is short acting, hydrocortisone at 20 milligrams, prednisone at 5, along with prednisolone, the methylprednisolone at 4, and triamcinolone at 4 as well. You have the most potent, which are dexamethasone and betamethasone. Dexamethasone at 0.75 milligrams and betamethasone at 0.6 milligrams. And these are both long acting. We have our steroids, which are cortisone, betamethasone, dexamethasone, hydrocortisone, methylprednisolone, prednisolone, and triamcinolone. For ADRs, we have the short-term use, which is an increase in appetite, weight gain, fluid retention, mood swings, insomnia, indigestion, bitter taste, and an increase in blood pressure and blood sugar. And if they are used long term, this could cause Cushing's syndrome. For black box warning, we want to be warned and counsel patients for any adrenal suppression. And you want to taper off these medications when they are taken for more than 14 days. If they are not taken for more than 14 days, tapering off is not necessarily necessary. But if they are taking it for more than 14 days, you want to make sure they are tapering off. And when patients are taking these steroids, any contraindications include any live vaccines or any serious systemic infections. Some things to take into consideration about steroids is they do cause a strong anti-inflammatory effect. Cortisone is the prodrug of cortisol, and prednisone is the prodrug of prednisolone. Prednisolone is often used in children. Treatment indications include replacement therapy, autoimmune diseases, post transplant, and asthma. And they're usually taken once a day. And you want to counsel patients to take between 7 a.m. to 8 a.m. to mimic the body cortisol release. So let's dive into what is Cushing's syndrome. Cushing's syndrome is an adrenal gland that produces too much cortisol, causing many side effects. Exogenous steroids in high dose may also increase cortisol, causing this. So, an increase in cortisol leads to a negative feedback, which is making your body produce less cortisol, ultimately causing hypothalamic pituitary adrenal suppression. High steroid intake can lead to any GI bleeds or ulcers, a stunt in growth, glaucoma, cataracts, psychiatric changes, poor bone health, pink to purple stretch marks, moon face, acne, a term known as buffalo hump, which is just a bump on the lower neck, diabetes, dysmenorrhea, hypothyroidism, muscle wasting, infection, impaired wound healing, and in women, it could cause hirsutism. Some key concepts are for immunosuppressed dosing is more than 2 milligrams per kilogram per day or more than 20 milligrams per day of prednisone or prednisolone for more than 2 weeks. Immunosuppressed patients cannot get live vaccines. They have a higher risk of infection. And to taper off any steroids if the patient is taking it for more than 14 days. And common methods include decreasing the dose by 10 to 20% every few days. And that's all we have for steroids review. Hope you enjoyed the video. I'll see you in the next one.